Community Health Assessment by Shatandra Pell. Atlanta, Georgia 30312. According to the U.S. Census Bureau, April 1st, 2010, Fulton County population was approximately 1 million. 52.3% of those citizens were African American or Black, 40.1% for white Americans, and 4.6% for Hispanic or Latinos. According to the U.S. Census Bureau, from 2013 to 2017, in Atlanta, Georgia, there were 89.9 high school graduates from the ages 25 and older. Bachelor's degree or higher ages from 25 and over were 48.7. According to the U.S. Census Bureau, from 2013 to 2017, in the Atlanta, Georgia population, persons in the civilian labor force ages 16 and older was 65.2. Keep in mind that the civilian labor force are those who are able to work from 16 and older that are unemployed or employed. Persons without insurance is 14.3%. Persons with disabilities under the age of 65, 8.7%. According to the Atlanta Police Department, citywide, including all Atlanta zip codes, in 2018, in the year to date of 2019, there were a total of 23 and 31 murders, respectively, 58 and 76 rapes, respectively, 279 and 266 robberies, respectively. According to the U.S. Census Bureau, from 2013 to 2017, the median household income was $51,701. The median selected monthly owner cost with mortgage, meaning those who have a mortgage and own a home, is $1,754. Median gross rent is $1,037. Persons in poverty, 22.4%. And according to the Bureau of Labor Statistics, the unemployment rate in the city of Atlanta is 3.9%. Access to health care. The listed facilities are within a 10-mile radius from the area code listed. Atlanta Medical Center is a level 1 trauma center. Grady Memorial Hospital is a level 1 trauma center. Emory Hospital, private hospital. Piedmont Hospital, Piedmont Urgent Care, Georgia Care for Women, which is considered a free clinic or offers free services, which you would find is located in the Atlanta Medical Center, Planned Parenthood, Sheffield Healthcare Center, the Center for Health and Rehab, Urban Health and Wellness Clinic, and the Good Samaritan Health Center. There are plenty more facilities that I did not list, but those are the top ones that came up for that zip code within a 10-mile radius. Barriers to healthcare: lack of insurance, which we saw in the statistics, lack of knowledge of community resources, and poverty based on what we saw for the statistics. I chose lack of knowledge of community resources because there are plenty of community resources in the city of Atlanta. And based on my patient population and discussions and education with my patient population, they are not aware of all the community's resources that are available to them. Community strengths. Education. There are several public and private universities in the area that have access to public transportation. Georgia State University is within the 10-mile radius of the zip code. Emory University, which is a private university, is within 10-mile radius of the zip code, and also Mercer University, which is also a private college or university. There are multiple public and private hospitals, skilled nursing facilities, rehab centers, and urgent care accessible to the public transportation. Those were listed in access to health care. Transportation, they have the MARTA, which is their public transit. They have several bus stops and trains to many counties throughout the state of Georgia. And the city of Atlanta is a walkable city. You can get to multiple places by foot. Community challenges. Poverty. I would say poverty is a community challenge because Atlanta is a growing city, but in the area that I am serving, which is the zip code listed, which happens to be near my job, there are a lot of homeless people panhandling at my car every morning. You'll find people sleeping under the bridge, on the streets. People have tents. So there seems to be a lot of homeless people in the inner city. Crime, as you can tell from the statistics listed, there's an increase in crime in the city of Atlanta from 2017 to 2019. But the population is also increasing yearly. Education. Though there is a great amount of citizens graduating from high school, the amount of citizens completing a higher education is much less. Prevalent acute or chronic diseases. Hepatitis A. There has been a surge of hepatitis A and E. coli outbreaks according to the Fulton County Board of Health. Risk factors include lack of hand washing before preparing and eating food after using the restroom, drug use, and through sex. For chronic, we have listed diabetes. According to the Department of Public Health, there has been an ongoing increase in diabetes in adults and children who live in Fulton County, as well as the rest of the state. Risk factors include obesity, inactivity, and poor nutritional choices. Also listed is cancer. According to the Department of Health, there is an increase in cancer in Fulton County as well as the state of Georgia. Risk factors include smoking, lack of healthcare screenings, and environmental factors. What is very interesting, I have here at the bottom, motor vehicle crashes were ranked the number one cause of death in Fulton County from 2013 to 2017, ages 17 to 25. That is very prevalent right now in the state of Georgia. I believe when I drive to work every day, the marquee on the highway tells us the fatalities for the year. So far, I think it's over 400 people have died in car crashes in 2019. Community interventions. I have listed hand washing community campaign to prevent getting and spreading hepatitis A. According to the CDC, hepatitis A can be transmitted through drug use, eating contaminated food with fecal matter, poor hand hygiene, and sex. Prevention can be achieved by frequent hand washing with soap and warm water or vaccination. Along with the hand washing community campaign, it's just infection control. Obviously, if there's a surge in hepatitis A, there has to be some community education about hand washing, and especially in restaurants and keeping things up to code. I think that they would benefit from that. Just, TV ads, whatever the case may be. Discounts on defensive driving courses. In 2018, Georgia became a hands-free state, which the state of New York has been forever. The new law prohibited cell phone use while driving. As depicted in the statistics in a previous slide, motor vehicle crashes are the leading cause of death in young adults in Georgia. Discounts on defensive driving courses may encourage young adults to take the course for safer driving practices. I work in a trauma hospital, so I definitely have a floor full of motor vehicle crashes, and they do range from the ages of 16 to older adults. This slide is dedicated to the pictures at my hospital, Atlanta Medical Center, which is a level 1 trauma center. You'll see the helicopter pad, the rehab connected to the hospital, the pharmacy across the street from the hospital. The emergency department is listed here. The MARTA stations are near here. as well as the bird scooters that often cause a lot of traumas in the hospital. But as you can see, I took most of these pictures, from my hospital window. This slide is dedicated to the community resources in Atlanta. We have Atlanta Community Food Bank, the Ronald McDonald House. These are pictures of my community service at the food bank. We have Grady Hospital, Grady Memorial Hospital. It is a level 1 trauma center. They're known for their burn unit and sickle cell center. They're definitely known for those things. A lot of people come from all over the place just to be seen at the sickle cell center. They fly people throughout the state just to get to the burn unit. Grady is a really big deal in Atlanta. My hospital is trying to get on that level, so Grady is a public hospital and they do a lot of great things there. So these are great resources in the community that I wanted to share with my PowerPoint.